Jana, just so you know, Janelle is in the other meeting. There was kind of like 2 meetings I had, so just so you know.
Who is Kayla? Sorry.
Janelle Muse, I think, or whatever, is in the other meeting.
Oh, okay. Yeah. Sounds good. Thank you. There's Julie. Then I'm just going to ask everybody to make sure you're on mute if you're not currently speaking. Just to avoid feedback. And
trying to enter on the other one, so we'll see. I don't want to give one back. Are you getting me now?
yeah.
I'll leave this one. Is there visual now?
Not that I can tell.
Okay.
I can see where it says North Dakota Olmstead Commission.
Well, we could see you for just a minute, Wally. I didn't.
Oh, you could. Okay.
I could see him for just a minute. Yes.
People keep moving around on my screen, so it's hard to keep track. Okay, well, I think we will go ahead and get started.
I apologize. I don't understand. But it's not working on either computer that I've got. So, all right. You won't have to watch. You won't have to watch me very much anyway on this. But it's. I welcome you all to our quarterly meeting here in November, and I think everyone has received a copy of the agenda. And the agenda today is going to be pretty straightforward. We'll be discussing the Olmstead plan revisions and have a general discussion with the subcommittee that's worked on that. And so that's going to be the prime agenda piece today, plus any comments that come in afterwards, and also selecting our meeting dates for next year. So I guess I would entertain a motion to approve the agenda if it's acceptable to everybody online.
Judy Lee approves.
Ramonic, second.
Okay, thank you. All those in favor signify by saying aye.
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 Opposed, same sign.
Aye.
Okay, the agenda is approved as presented. And then we'll also do the administrative task of looking at the August minutes, the meeting held on August 9th in Bismarck. Has everybody had a chance to review the minutes? If so, I'd also entertain a motion to approve the minutes as submitted.
I'll make a motion to approve the minutes.
Thanks, Carlotta.
This is Veronica. I'll second.
Thank you, Veronica. It's been moved and seconded. Is there any discussion? Any question concerning the minutes? If not, all those in favor signify by saying aye.
Aye.
Okay, opposed, same sign. Okay, the minutes are approved as submitted. Okay. All right, well, I'll turn it over to you, Jenna, to, well, I guess maybe prior to that, we should take a check as to have each of the board members, the commission members introduce themselves and check who's all here today.
Sure.
And maybe if everybody, for the purposes of anybody else online, if you would just, the commission members identify who they represent as they introduce themselves. Thank you.
Do you want me to call out people, or do you want to just start as to who's available?
Yeah. Well, on my screen, maybe I'd start with Scott. It's what first face I see.
All right. Hi, everybody. I'm Scott Burlingame from Independence Incorporated in Minot, and I represent Centers for Independent Living.
Thank you, Scott. Carlotta?
May I suggest that Jenna or somebody call on people so that we could just whip through this? That'd be
This
great.
is Carlotta. This is Carlotta McClary with Mental Health America.
Thank you. And if you want to do as Senator Lee has mentioned, maybe just mention each one that you see online. Jenna, I just see a couple.
Sure. Let's see, we go down. Julie,
Julie Horntet's here, DD Council.
Senator Lee,
Judy Lees, Senator from West Fargo, District 13, Chair of Human Services in the Senate.
Judge Romanek,
Bruce Romanek, District Court Judge, South Central, so stationed in Bismarck and 9 counties around.
Representative Mitskog,
Good afternoon, Elisa Mitskog, I represent District 25, Southeast North Dakota. I serve on appropriations, the HR section in the House.
Veronica,
Veronica Zietz, Protection and Advocacy Project.
let's see, did I miss anyone?
I think that's everybody. Doug Norrell, Ryan Norrell, our co-chair, was attending the Western Governors Convention in Jackson Hole, Wyoming today, and was unable to be with us. He was seeing if his schedule would provide a chance for him to join us online, but we'll see if that happens. And do we have any of our advisory council with us today?
Let's
Trevor
see.
Vanette's here.
Trevor, thank you.
Matt Shores.
Janine Feist, Family Voices of North Dakota.
Thank you, Denise.
Toby Lundstead.
Thank you, Toby.
Jessica Dargis.
Thank you. And Cheryl, did you want to introduce yourself? You're on mute right now, Cheryl. There you go.
Oh, this is Becky. Actually, Cheryl's picture's up, but she's not participating in the meeting. This is Becky Rosencrantz, former P&A employee, back helping out with taking meeting minutes.
Thank you.
Great to have you back with us.
Thank you, Wally.
All right, Wally, anything else before we get started with Nancy?
I think that's fine. We'll have, for advisory council and for any members of the public, we'll have a space at the end of our discussion for comment. So if you would feel free to comment at that time, and we'll begin the review. Do we have all the subcommittee members here? Scott and Julie, I know, have checked in. Jake is online.
Yep,
Jennifer,
I think everybody's
Kayla.
good.
Okay.
Yep, Kayla trespass when he follows the person.
Okay. Thank you. Okay, Jana, well, I'll turn it over to you to do whatever you would like to do in terms of going through the visions and the goals of each of the parts of the plan.
So first, before that, we have Nancy Nicholas Meyer joining us from Aging Services. She's going to give us an update on the settlement agreement. And I'm assuming, Nancy, that you probably have a PowerPoint, so I will quit sharing.
And I don't know what's going on, but can you guys see me? Because all I can see is my background.
I just see your background. You popped up for a second, but.
What the heck? I don't know what goes on here, but anyway, well, good afternoon, everybody. I'm Nancy Nicholas Meyer, and I'm the Director of Aging Services for the Department of Health and Human Services. And I'm also acting as the Department of Justice Settlement Agreement Coordinator. And as you all know, we signed a settlement agreement in December of 2020 to try to change the way that we offer long-term service and supports in North Dakota, to make the focus on services that are in the most integrated setting. And a most integrated setting would be your private home, a family home, roommates of your choosing. And so we have been working on the settlement agreement now for 4 years. So on December 14th, it'll start the 4th year, which is crazy that it's gone that quickly. But we really have, I think, done a good job of trying to implement, the benchmarks and measures that are in the settlement agreement. And so today I thought I would just provide you with a little update. And we have something that we call key performance indicators that we've created that relate to the settlement agreement. And they're sort of like data measures. And so I thought I would just walk through that with you, but I would be happy to address any specific questions that anybody has. So maybe I'll just stop there and ask, is there anything any of you want me to address, or do you we'll just get it going with the overview. Any specific question? All right, well, maybe this will trigger a few of you. So please, again, feel free to jump in at any time, but I'm going to share. Okay, can you all see a PowerPoint?
Yes, thank you.
So every quarter, we are going to be producing these, what we call key performance indicators, and they're part of our reporting requirements for the settlement agreement. And so what they do is they'll show the most current information that we have. So this current quarter, the first 3 quarters of 23 are done. And so we have 1,174 referrals have been made for home and community-based services in that particular period of time. And then they also kind of give you the history. So in 2021, we had about 1,800 people referred, and 2022 is about 1,800 as well. And so we're on track to do that same amount. So our initially from 2020 to 2021, our service referrals went up 36%. And they have stayed at that higher level, and we don't think it'll change anytime soon. There is a real demand for home and community-based services for older adults and adults with physical disability. So that has really increased our caseloads. We have weighted caseloads, so we try to assign cases that are based on sort of a formula. And so if you're helping somebody with a lot of care needs, that gets a higher point than somebody who might have low and maybe doesn't need as much case management. So right now our ratio is 121 per each case manager. Last year it was 117, and the year before that it was 110. And so our goal is to get it back down to about 110. We were very fortunate to get 7 additional home and community-based service case managers in the last legislative session. And so they're all hired and in place. And so we're hoping that these numbers in the next quarter or so will go down, because we were able to redistribute the cases to those new case managers. The other thing that we did is we created an aging and disability resource link. So the way that you would get access to these home and community-based services is by calling or what we call ADRL, or Aging and Disability Resource Link. And it's an information and assistance line, but it also is how you would apply for these services. So people can call, they can go to the website and put in an intake referral, And so we had 36,000 unique inquiries into our services last year. So we know there's a high interest, not just from people who need help paying for it, but from a private pay market as well. There are a lot of older adults and families looking for these types of services in the home, and many of them go through the ADRL in order to find that information. So you can see the growth there as well. So in 2021, it was about 34,000 contacts. 2022, about 43,000, and we're on track to do that much again this year. The other thing that we look at is just how many people are of our target population, and the target population for this particular settlement agreement are older adults and adults with physical disability who meet a nursing facility level of care. So it was really about unnecessary segregation of older adults in a skilled nursing facility who said, I would rather be at home. I can't access the services I need in order to stay in my community. And so we look to see the number of people that we are serving on Medicaid in the skilled nursing facilities. And for the first 3 quarters, it's 2,412 unduplicated individuals. In 2021, it was 2,376, and then it jumped up a little bit. And I think that was due to the visitation restrictions being lifted in nursing homes. And so we're kind of hanging around that 2,400 mark with people living in the nursing home that are Medicaid recipients. And they would all be considered TPMs, target population members, for the purposes of this settlement. So we look at that versus how many people are we serving in the community. And so right now, in the first 3 quarters, we serve 2,785 unduplicated individuals. Not every one of those people would automatically qualify for a nursing home, so it's a little bit different in the numbers. And so in 2021, we were at 2,300, and in 2022, about 2,500. So our numbers continue to increase as the demand for these services is certainly there. So we also keep track of how many actual TPMs, so people who really would meet that nursing facility level of care and they're on Medicaid or they're applying for Medicaid. And in the first 3 quarters of 23, we helped 574 unduplicated TPMs. And so those are actual people that would be the equivalent of a nursing home, and 230 of them were new. So we brought 230 new people on. And so the nature of the people that we serve is some of them are older adults, at end of life. And so we have a lot of people who go on and off of our programs. But the number one reason that people go off our programs is because they passed away. And so we're able to serve people through the end of life in their homes, which is really, what some people are looking for. And you can see that the way that we divert most people is through our Medicaid waiver program, which makes sense because that is supposed to be the equivalent of nursing facility services that are offered in a home setting. So in last year, we did we helped 494 TPMs, and 308 of them were new. And in 2021, it was 273. And then we didn't track the new ones back then. So our data keeps evolving. So we talk about diversions, and that's what I just spoke about. And a diversion is, somebody qualifies for nursing home care, but they did not go there because they found an alternative in the community. And so we have an obligation under the settlement agreement to do so many diversions and so many transitions. And we've been able to meet or far exceed what the settlement has required of us. But if you're talking about transitions, and this is where the Money Follows the Person program and the Centers for Independent Living, Kayla and Jake and many others have really working hard to increase the number of people that we're helping to get back into the community. So in the first 3 quarters of 23, we've helped 88 target population members move back home, and 50 of those transitioned happens within 120 days. The only benchmark that we're not currently meeting in the settlement agreement is that we're supposed to have all of our transitions are supposed to happen within 120 days. But that is really the wrong metric, because there really is no way that we can help some folks who have considerable barriers to community living to be able to move home in 120 days. And so the DOJ knows that. We talk about it a lot, and no one's making an issue of it, because we really are trying our best to make sure that our transitions are safe and that services and the right housing and everything is in place before somebody moves home. Because if not, they are at risk for reinstitutionalization. So that's the one metric we continue to work on. But we have not 100% of our transitions are happening within that time frame. And last year we helped 121 people transition back, 87 of them within the 120 days. In 2021, it was 91, and 78 of those occurred within 120 days. And so again, we keep working on that, but we only needed to transition for purposes of the settlement agreement, 150 people total. And so you can see that our numbers have really exceeded that. So the other thing that we do now that we've never done before is that we're obligated to talk to every person who gets referred for a long-term stay in a skilled nursing facility when Medicaid is the payer. And so we have a team of 10 staff all across the state. They go to all the nursing homes and they talk with people about their options for home and community-based services, what happened to get them into the nursing home. And they talk a little bit about what their goals are and how they want to live. And so if they want to be referred for Money Follows the Person to try to transition back to the community, we do that. If not, then we just give them our information. And then every year when they get their annual nursing facility level of care redetermination, we'll talk to them again and see if there is any interest in moving home or if they're satisfied with the services that they're receiving in the nursing home. And so during the first 3 quarters, 26 of the people that said they wanted to move back to the community were actually moved home during that period. In 2022, it was 37 individuals that moved home during that time. And then in 2020, we were not collecting that data. So again, that's where, we just keep evolving and trying to get better data as we go along. The other thing that we really are obligated to do under the settlement agreement is to help people find supported housing. If you're going to live in the community, you have to have a place to live. And so there's 2 options. That's how I sort of simplify it by saying there's 2 options. You can either keep the home you have and live there, right? Or the apartment or whatever, or you're going to have to find a new one. And we would like to keep as many people as we can living in the housing that they have currently, because it's easier than trying to find an affordable, accessible home. And so we've been really trying to focus on home modification and things that we could do to help that person's home be habitable for them. Maybe after they now are not as mobile as before, and so they need some different adaptations. And so we've been working to try to encourage the construction community to get involved. And a lot of what we're doing is ramps and door widening. We've done some remodels on bathrooms, but we've done 26 home modifications in the first 3 quarters. And we did 40. We didn't keep the data before, but it was 13, I think, what we did the first year of the settlement agreement, and then maybe like 20 or something the second year. So we keep increasing, but that is an area that we really want to continue to work on, mostly because it's really hard to find contractors who will work within the guidelines of what Medicaid requires for payment. You have to do the job and then we pay it. And that's usually not how they want to do business. They want a deposit and all of that. And so we're working on some strategies of that as well. But the other thing that we're obligated to do is help a certain number of people with rental assistance. So those folks transitioning back to the community, if they can't afford to pay their rent, we would need to help them pay that rent until they could get on like a long-term, federal voucher or something. So in the first 3 quarters, we're helping 46 individuals with rental assistance. In 2022, it was 36. In 2021, it was 13. And those are within the benchmarks that are required. They were kind of low numbers because when you start paying rent, it's sort of a long-term commitment because it could be a couple of years, or maybe even up to 4 years to get a voucher in certain areas. And so we really have to make sure that we have the funds available to take care of that rent long-term while they're waiting for those federal benefits. And so the other thing that we have done is we've worked with the Minot State staff, the housing coordinators, who just really do an excellent job. And they are helping us to provide other housing support. So maybe people need help finding the place. Maybe they, need some other kinds of housing support. And so we are tracking that a little bit differently now. But currently in the first quarter, we helped 46 people with that supported housing. And the rest of the individuals, they maybe have their own home or a family home or somebody else to go back to. But in 2022, we helped 99 people. And in 2021, we helped 28. So our numbers again continue to rise. The other thing that we're going to be doing is collecting this on the diversion side. So we want to know who's living in the community getting HCBS and also getting some type of rental or supported housing. And so we'll start tracking that soon and probably have better data in about 6 months or so. And this one is we have to keep track of who maintained their housing during a skilled nursing facility stay. So if you go into the nursing home and it's really just going to be a short-term rehab, there are steps that people can take to make sure that they can keep their apartment and that they can continue to earn their income from Social Security, those types of things. And so we never started tracking this before, so this number looks really low. But we do now ask the questions, of whether or not things have been done, the steps have been taken so that person doesn't lose their housing while they're rehabbing in the nursing home, if it is their intent to move back home. And then we look just at cost. This is a question that we get a lot, but what are the average individual cost comparisons between the different settings? And so this was from state fiscal year 23, and you can see our expanded SPED program, SPED, it's, a little over $6,000 a year to maintain someone. Many of the people on SPED and expanded SPED would not screen at a nursing facility level of care, but some do. And I think it was about 27 of those people that we've transitioned so far are actually on our SPED program, but they could be served in a nursing home. And then we have our Medicaid state plan personal care program. So if you're on Medicaid and you have any kind of an impairment, maybe you need help with bathing or dressing or toileting, you could potentially qualify, and that's about $29,000 a year. And then we have our waiver, which really would be the equivalent, the home equivalent of a nursing home. That's what waivers are. And so that's about $59,000 average. And that's actually increased because the number of people that we are serving in the community, our numbers on the waiver have grown a lot. And so the annual costs have grown a little bit too, because many of the people we serve need those 24-hour supports, and those are higher cost services. And then our basic care program is about $20,000 annually, and the nursing home is about $122,000 annually. And then those bottom numbers are the number of people that we're currently serving. These aren't unduplicated because you could be on more than one service at a time. Like you can be on SPED and state plan personal care, etc. But expanded SPED was really designed as a program to be the community alternative to a basic care. And then, like I mentioned, the waiver is the community equivalent of the nursing home. And some of the people on the Medicaid state plan personal care program, they have to screen at that nursing facility level of care in order to give a higher level of services. So we can provide up to 12 hours of care under this particular program. And so those folks have to screen as well. So there's, we use these different programs in a flexible way to try to support as many people as we can. And then we have to also speak to all the individuals. So I talked a little bit about how we talk to everybody who's newly referred to a nursing home. We also have to talk to those people who have been in a nursing home for a long time. And so prior to the settlement agreement, if you went into a nursing home long term, you would have had to have a nursing facility level of care screening. And if you didn't have a condition change, you would not have had to been rescreened, and you could maybe live there for 2 years or 5 years, and you would never have had a new redetermination. But the settlement agreement requires that we do one now annually on everyone who's in a skilled nursing facility, and that's already been required on the home side. So we do that for every Medicaid member who needs this level of service. And so if during that time, that annual renew, our staff go meet with the people that are living in the community or have been there for a long time, and we have a conversation about their services, how they want to live, what are their goals. And so you can see the numbers. So they've made 795 visits so far this year, 976. Well, that was just in the first 2 quarters. And then you can see in 2022 was a little over 1,000. In 2022, it's 886. So that has been a really great way. I know the staff who do this, they say that they should write a book about all the wonderful stories that they're hearing about people's lives, and that some people, this is the only visitor they've had. They say they're so excited that someone's coming to talk with them because they just don't have a lot of outside visitors. And so there's been some kind of residual benefit, I think, of meeting with people and just checking in. And we've had families call to say that they've appreciated that, we're asking about Medicaid coverage and, making sure that the people are getting what they need. And then just a little bit about our providers. So we have qualified service providers, and that's an agency or an individual that signs up. It's kind of like a DSP on the DD side. They're the people that do the direct care. And so we've enrolled 174 new people in the first 3 quarters. 155 were individuals and 19 of them were new agencies. And so we are seeing a lot of growth in this field. And that's for private pay and also for people willing to serve our Medicaid and state funded consumers. And then last year we did 452 new QSPs, 441 of them were individuals, 11 new agencies. So we far exceeded our agency applications already this year. But a lot of people sign up just to help a family member, a friend. And so we turn over a lot of applications every year. And we are actually building a new portal so that it'll be easier to put your application in for services. And that'll be available starting in probably January of 24. So we're excited about that because right now it's a pretty cumbersome process and it can take a really long time and it's all done on paper, but we're changing that with our portal. And so we're hoping to be able to turn applications around much quicker. And that's really important because if somebody's in the hospital and they need to have some sort of support, and they're choosing between the nursing home or the home, we want, if their daughter or someone they know is willing to be that provider, we want to be able to get that application in and turned around. So that person maybe doesn't have to go to the nursing home. They could go straight from the hospital to the community. So you can just see kind of how many we process and how many we go through each year. And then we have a metric of trying to process them within 14 days. We are not currently meeting that. And again, this isn't required in the settlement agreement. It's just something like a benchmark we sort of set for ourselves. But I'm really hopeful that we'll get there now with the new portal that's coming in 2024. And then we also just sort of keep track of how many of our providers are expanding the services that they provide. And this is a metric I think is interesting because it shows that it's making money, right? That they're willing to add on services. They're going to continue to grow their home and community-based services. And it's viable for their business, and they realize that and then start adding on more services after they originally applied. And then we try to keep track of like who's available in our rural and tribal areas because we know it's so hard to serve people in rural and frontier North Dakota as it relates to home-based services. So we try to keep an eye on that as well, and it's one of our metrics. And so we keep track of that for each year. One of the things that we get asked a lot about is, who are you serving? How many providers are in each county? So this is just something that we've maintained for a long time. Started one session when one of the legislators asked us for this information, but we serve someone in every single county in North Dakota. It may not be many, but we do serve someone. And usually in those really, like out in the West, it's often the family members who are providing the services. And then we also track complaints. And we have actually seen an increase in the number of people that have complained about home and community-based services. It makes perfect sense because, we've grown in that first year. We went up by 36%. And so you can expect some of that as well. But we also want to make sure that our services have quality and are appropriately serving people in the community. And so we follow up on all complaints. And so we have to report all of that to the Department of Justice. Every critical incident report has to go to them. And so we have 7 days to submit them to them. And so that's a big part of what I do every week is send the critical incidents to the DOJ. But it's interesting data. And so we had 96 complaints in 2022. So you can see how they've grown. And a lot of that is because of the education that we provide too. And then we ask our providers to let us know when things happen. So if somebody passes away, if somebody had to go to the emergency room while they were providing care, if there was a fall, any allegations of abuse or neglect, they all have to be reported. And so we keep track of, are they reporting them on time? And it's quite a turnaround. It's like 24 hours and 70% of them are coming in within the 24-hour time frame. Last year, it was 64%. So our team does education every quarter with any provider who are willing to come to our trainings. And they have so much turnover in this field that you have to almost do it quarterly, at the minimum, because otherwise they don't understand the requirements, because everybody's new. There's often new leadership. And then we have to have remediation plans. And so we sometimes require them to give us an answer, to get training, to have a consultation with the Alzheimer's Association. There's lots of different things that we can do up and including termination of the care if they're not doing what they're supposed to do. And so those are just a little bit of our metrics. And I think the last thing I would just want to talk a little bit about is about some of the barriers that we see to community living. And they're different than I would have said 4 years ago. But really, the reason why we've had to like deny services for someone, it's almost exclusively in the last few months has been because of substance abuse issues. So people who are in need, who are actively using while they're getting services and putting others in health in jeopardy because they have an addiction and they have not chosen treatment. And so that is really an issue that is a barrier to community living. Other behaviors on the part of the person who needs the help jeopardizing their services. Sometimes people they're really hard to work with. They're very rude to their providers. They make racial slurs, and the providers just won't put up with it. And so they're saying we're not going to serve that particular person anymore. And so we have some clients who really go through a lot of providers just because of some of those kinds of things. And so that's different than what I would have ever said, 4 years ago. The other thing is just a poor rental history. Like they really have a hard time getting an apartment because of convictions or because of money that they might owe for back rent or other things. And then really, people talk a lot about providers and not having enough of them. And we find that we can find them generally, but sometimes the staff that are employed they're absent, like they don't come to work. And so that is really the problem. So the agencies are willing to take the clients, but the people that they're hiring are not always coming in. And so that provider absenteeism is creating a barrier for some people because they have to have up to 24-hour care, for example. And if somebody misses a shift, that's a very big concern. We did get money during this legislative session to offer a stipend to QSP agencies that are willing to have an on-call staff. And so we'll be rolling that out here in the beginning of 24. And then the other issue that we see a lot is guardians and legal decision makers who just are not supportive of that person living in the community. And so the person might express an interest in going home, but the guardian of the legal decision maker does not support that. And so those are things that we, try to work out. But that has kind of risen as an issue as well, or they don't have anybody to speak for them. So maybe it appears they maybe not really have capacity due to dementia or something, but there's no one really to say, yes, they should go home or no, they shouldn't go home because that person doesn't have a guardian legal decision maker. But it does not appear that they're competent to make that decision on their own. And so those are just some of the kind of surprises, I guess, in the last 4 years for me. But happy to answer any questions that any of you would have based on what I just talked about.
Yeah, thank you, Nancy.
Yeah. Any questions?
Senator Lee had her hand up.
Yes, Senator Lee.
Yes, if I may ask a question or two of Nancy. Thank you, Nancy, for an excellent report. And you might just be asked to provide that at an interim committee at some time in the future. So don't throw away your slides, please. In fact, I'd love it if they could be forwarded.
Yeah, they can.
But when somebody in the facility would like to go into the community, but the guardian or family members don't want them there, I get that, because sometimes they're just fearful. Maybe they're going to be alone. So if I am a farm wife in a frontier county, so 6 or fewer people per square mile, in the middle of the section with a gravel driveway for a half a mile to get in, 4 miles from a town that's got 50 people, does that have an impact? I have a relative like that. That's why I'm talking about it, or did. How does that affect the decision that they should be able to go home with home and community-based services? Because if somebody falls, so I'm curious about how when they look at a rural area, when the DOJ, who is also living there in that high dense population area, is evaluating how we're doing this. Do they recognize the challenges that there are not only for finding QSPs, but also for the individual who may be served every day, but only for a couple of hours? Not all of this is going to be 24/7 care, as I recall, right?
Yes, yeah, those are really great questions. So one of the things that we do is that we have a transition team, and that's new. So in the last few years, we put together a team of 3. So if you want to go home and you're in the nursing home and you say, hey, I would rather be in the community, you get assigned an MFP transition coordinator from the Centers for Independent Living. You get an HCBS case manager who would help you with like what kind of services are you going to need. And then there'd also be housing facilitation so that, let's say I want to go back to my farm. So that would be talked about. They would have to do a risk assessment. So they'll talk about the fact, like, what are you going to do in the winter? And when are you going to do, if you're blocked in and someone can't come? And so based on that information, they might be given options and say, well, we may not be able to get you back to your farmstead, but maybe we could get you to, an apartment, or, are you willing to move? Some people are willing to move out of their communities. Others say, no, I want to go back to the community. And so they have to address those things. And that's why it's taken longer than 120 days, because some of those things are really true barriers, right? And we have to work through that. But that's where, the team comes into play and trying to find, those supports. But I do think that the DOJ does recognize and actually gives credit to North Dakota for trying, to do this in a way that makes sense. And they've really not pushed back on the fact that we're not doing them in 120 days because they see the effort. They see that we're really trying to do this, but it's difficult and we can't always find, a place. And so sometimes it's just having that conversation kind of over and over again, I think, as part of the care planning. But I don't know if anybody else, Scott, you definitely know all the challenges your staff see, but if you could have any other thoughts on that.
Scott, go ahead, and then I'd like to follow up if I may.
Yeah, I'll just quickly follow up too. I think, Nancy, what you said was absolutely right. I think that, really looking at the holistic situation that people are coming from, and I'm a guy that grew up in small towns. I get a lot of what you said, Senator Lee, and the importance of that. And in fact, I have a family member right now who just recently, unfortunately, due to some health reasons, did end up in a nursing home, but he's 97 years old. He gave it a pretty good try in the community beforehand. So, but we all had these same conversations in this process of trying to, look at the safety of it. Nobody within the team is trying to set anybody up in a situation where they're going to fall on in the middle of winter and not have some mechanisms. But there are sometimes, stopgaps that can be put into place to ensure that that doesn't happen. So.
Well, and I'm not worried about the North Dakota people who are doing the work and trying to help people get settled. I'm just wondering if the Northeast elite are paying any attention to what the weather is like here in January compared to July. But my additional follow-up is the state isn't going to buy Apple Watches for everybody who's in this situation, yet we really need to know when they fall. I mean, but those less expensive devices that can be available, are those, is it possible to fund those through any of the services so that falls are recognized? I mean, I'm just trying to get acquainted with what you do a little bit better.
Yes, certainly. That's a great question. So yes, we have emergency response, and they used to be that, I've fallen and I can't get up, that commercial, where they push the button. Yep. But they're much more sophisticated than that now. So they can actually detect falls. And so some of them have more bells and whistles, but we do cover those under all of our funding sources. So those are things that we put into play. One of the things that's happening is there's a big discussion around virtual monitoring and what you can do to help people. And I know in the intellectual disability world, that's a big conversation that's happening right now. And so there might be some future things. We're also working with ND Assistive, and they've been very helpful, and they're setting up like smart homes for people. And so people that used, maybe they would have had to have someone else turn the TV on and off or their lights on and off. They can do that now by voice activation, by buying them an Alexa system. And so we've seen that part of our work really grow. So I think there, you know, technology is really playing a role and we're just at the bottom of it. I think we have to really dig into that more, but those are some of the things that can reduce the need for human intervention. Like I said, it's very difficult to find, you know, providers and everything.
Well, and a big shout out to North Dakota Assistant, because I've been a big fan of those folks for a long time.
Yeah.
Thank you.
Dr. Monik, you have your hand up?
I think I heard my name. Can everybody hear me okay?
Mm-hmm.
All right. Nancy, Mike, I have two questions. One is, how hard is it to fill out this form? You said that's quite extensive. Take people an hour, 15 minutes, 2 hours.
So the ADRL, yeah, so our intake is about 45 minutes. And so when we talk with folks, if they want to apply through the Aging and Disability Resource Link, it's about a 45-minute process, because they do ask the questions to really get to the heart of the matter of, will you be eligible for one of our state or federally funded programs? And so we have a metric. So if they say, if we think, yep, you know, you could qualify for one of these, it gets sent to a social worker in the field. They go out and make a home visit, and 71% of those are turning into a case. So we know that intake that we're doing is working. But we do tell people, like I had a call the other day, somebody wanted to ask some questions, and I said, you know, you need to start with our ADRL and make sure you've got a half hour or 45 minutes, you know, when you call. But our average wait time is 1 minute. And so they've been able to manage it. We have 6 staff who do that, and it really has been an effective way to market our services, but also I think to make sure that everybody gets asked the same questions. And then you know, the social workers are finding the information that they're given is valid, because 71% of those are turning into an active case.
And then you indicated that you were shifting to an online type of instead, or did I mishear?
Nope, that's for our provider enrollment. So right now, if you want to be a QSP, you have to fill out a quite extensive application packet, and it's all paper. But we're having a system built. And it's kind of like TurboTax, you know, where they ask you a question and then how you answer it, you know, ask more and more. And so there's not like a form to fill out. You'd answer questions that are asked of you depending on whether you're an individual or an agency or a family member who's trying to apply. And so we think we'll be able to get our enrollment down to our goal of at least, you know, enrolling them within a 2-week time frame, because it really, every time I see it, I'm more impressed with it. I think it's really going to be a huge benefit compared to what we have today. So yeah.
So thought is the massive paper is kind of a chilling effect on the people applying for it, correct?
Yes, and we've actually had people who say, I'm not doing that. Like I would work with you, but we're not doing that. And so we're hoping that this is going to be a lot better for agencies and others. Because like I said, there's a big market for this in a private pay situation. There's lots of new agencies starting that just help, you know, in the aging space. And we would love for them to help the people that we serve. But our processes are kind of a bit much for some of them. They're not used to this much paperwork and all of that. Good question.
We're here to help, right?
Yeah. Fill out this 100-page application.
And the last question I had is, you indicated that you have to provide a report quarterly. Is that something that like you could provide to maybe Jana and then she could share with the commission meeting members?
Sure. So we do these, what I just showed you is done every quarter and it's online, but we'd be happy to share that with Jana. And then we have to do an actual written report every 6 months. And that's all available on our website, but we could also forward that. Jana, I could forward that to you when it gets approved from the DOJ, and you guys could certainly have that.
I'd like it that way rather than sending me to a website all the time. I got enough of that going on, but I appreciate it. Thank you.
Yeah.
I see that Scott had his hand up, and then Julianne will go to you right after that.
Okay, thank you. First off, to kind of spin off, just a comment on the issue around QSPs. We had some folks last year that needed something as simple as, I believe it was snow removal, some kind of a chore service along that lines, and they would be eligible for QSP services in order to get it. And we actually went to our local homeless shelter and found a couple of folks who were looking for some part-time employment. And they wanted to, had a good back and wanted to make a little bit of money. And we said, well, good, we can sign you up as a QSP to help just out with that issue of it. And the second they saw how many papers they wanted to show up, they basically walked out and didn't want any part of it because it was so overwhelming, just that thing. So being able to kind of find simple problems for simple, solutions and help get somebody to pay to remove their snow to keep them in their house can make a big difference. So I'm glad to see the work that's being done on that. I also want to add just a general comment, Nancy, that as I listened to that, and I also look forward to getting a copy of this, I was taking like screenshots of it as you were doing it, because some of that data was fantastic as always, and it shows how hard this is. And as a guy that's been working on getting people out of nursing homes for 2 decades now, it's amazing to see how much has changed. There was a time when we were told nobody was in nursing homes that wanted to get out, and the system was just fine. And there was times that we were rejected at the door, and there was times after MFP started when, despite all the outreach that we would do, we can never actually identify the people that wanted to get out because they didn't really want to get out. But now we know that with informed choices and with real community solutions, there are a lot of people getting out, and we're seeing real effects. And looking at that cost indicator, which is something we've talked about when we do systems advocacy again for generation now, is that it will in the long run save the taxpayer dollars, even if it costs a little bit more to start with. And it is, we're serving more people in the community. It's a better policy. People are going to live longer and they're saving money. So I just really appreciate all the data that you showed today and all the hard work that's been done by everybody across the board to actually make a difference in helping people live in the community. So I just want to say thank you for that.
Thanks, Scott. And, again, kudos to the team that we have at Aging, to the SILs, to Minot State, to the nursing homes. They've really become, a lot of them have become partners, and, they've built relationships with our team. And one of the best compliments I think we could get is that the last time the Department of Justice was here, which was in June, they were visiting nursing homes, and they told me they felt a change. No one asked them who they were, it wasn't a big deal that there were people kind of milling around and lots of visitation and stuff. And so they felt like, it was different than the last time they were there. And so I think that's great. And we all have always said that we are about choice. And so if someone wants to live in a nursing home, there's nothing wrong with that. And that's a benefit under Medicaid, and we need good quality services as well. We just want everybody to have the information. And I think I think most of the nursing homes understand that, and they're fine. They're fine with that, and have, become better, I think, and, than maybe had been in the past.
Okay, Julianne, if you'd like to.
Yeah.
Answer.
Hi, Nancy. For that intake form that takes like 45 minutes or so to do you know if that's in plain language so it'd be easy for a person to understand that's filling that out?
It's a verbal thing, so they ask them questions.
Okay.
Yeah, and so they can kind of follow it up or say it in a different way. But if that's a barrier, if people don't want to, they want to do face-to-face, we will send someone out. So it's not the only way to do intake. For some people, it's just not a comfortable thing. They want to know who they're talking to, especially when they give income information and stuff. So they'll go out and make a visit. But in general, it's really improved and standardized the way that people get enrolled. One of the things in the past, I think, when we had the county system, was there were some counties that really had never done very much of this service, right? So they may not have known everything to ask and offer, and that's very different now because we've got kind of a simplified way of doing business, and they made it a little bit standard across the board.
Yeah. Representative Mitskog, do you still have a question?
I do, and I'm not sure if this pertains to this conversation, but the individuals that are in long-term care facilities, the JAIR psych type of facility, I think we have 3 in North Dakota, Nancy, and they've been discharged from the state hospital, and they really don't have any other facility to be discharged, like a step-down facility to be discharged to. And I know of a situation in one of my constituents. He's 29 years old, and he's in one of the JAIR psych long-term care facilities, and is very interested, as well as his mother, to be discharged from the long-term care facility transition into a community setting, but he needs a supervision. So would that individual, I mean, can you help me understand the process to, I mean, if he has a desire to be not living in that facility, I'm just curious on.
Sure. So there's a couple ways. They should have been talked to at some point or will be talked to by the long-term service and support options counselors, because they are obligated to see them when they come in, but if, or when they have their annual redetermination. So they will have somebody to connect with, but at any time they can reach out. So they could call the ADRL, or they could call and they could just say, we would like to talk to somebody about this. And then there would be a referral made, and somebody likely from MFP, Kayla, or they would go out and they would have a conversation to see kind of where they're at. And if they said, yes, we'd like to make a plan, then that team is formed that I talk about, the 3 people, the case manager and the housing person would, sit down and do person-centered planning and try to come up with a way that that person could access the community. The other thing that we know we need to do with our providers is they need a lot more training as it relates to behavioral health, because it's a real challenge. And our system was set up to help people who just knew how to do things, but they just physically couldn't do it anymore, right? Like they didn't have, there's a lot more to it than that. And so there's a lot of substance use, there's a lot of chronic mental illness. And the providers don't always know how to respond when someone has behaviors, and that can jeopardize their ability to be in the community. So we have work to do on that end to offer more opportunity for someone with the needs that you're describing to come out and live in the community and be successful. But they could call it 0.
Yeah, and I was just gonna say that the individuals at the state hospital, we worked out a separate policy with them, so we aren't sending in options counselors, but working with the state hospital in general for what their person-centered planning is, and notifying them of the individuals that would potentially come up on our list as target population members. So not Nancy, but Sandy and I met with them, and they are actually just asking those specific questions themselves and then getting that report back to us.
Thank you for that. And I've had numerous conversations with Pam Sagnas and others at DHS regarding, I think about, there really is a void, and we need to do a better job on the discharge from the state hospital, especially with those long-term patients. But knowing that there are not a lot of realistic viable options, and for somebody like my constituent that is going to need, I think, almost constant supervision or oversight, that where are those possibilities in communities. So it's unlikely that he'll be able to live independently, but and I look at what's available in our area for community-based home and community-based services, and there's just no services here that would be able to provide the behavioral health needs of this individual due to his complex diagnosis. So yeah, I just think we need to keep that on our radar. It's still, and I think as we go into the next legislative session to talk about what we need to do to provide more services for those individuals that really should not be living in a long-term care facility. It's just, somebody that's 29 years old, very high functioning, very smart individual, but it's just, there's no other place for him to live. So,
and we do definitely offer 24-hour supports. It's having that right training, so that those providers know what to do to support that person. And that's the piece that we need to work on. I think it's getting, because we have providers who say they're willing to do it, and they are, but then when they get in the thick of it, they don't really have the background or the knowledge. And so I think that's really good points that you're bringing up, and is something we need to work on. So.
Just a quick question, Kayla, did you say what you wanted to say? You had your hand up?
Yeah, I think, yep, I kind of said, and we do work closely with the behavioral health division and staffing a lot of these complex cases too. So I think a lot of us are always brought to the table to just kind of brainstorm what kind of needs to happen, but we see the need as well.
Okay. And Senator Lee, you have your hand up.
Just to let Representative Mitzcog and others know, excuse me, I was on a meeting in the last week or so, maybe two, to address that talked about, among other things, the geropsych services for people who are not old, because so many of the situations are nursing homes in which we've got somebody who is 26 years old but has behavioral issues that has nothing else to do there, and so we've got that age group that's over 18 or 21, beyond school age, so that service is not available through the K-12 schools anymore, because they can stay there till they're 21 if they wish. But then we've got a period during which everything is not quite, we're working on this. I think everybody would agree that does work with it, that we're working on this, but part of the challenge is the workforce. And we all talk about how excited we are to have all these new businesses coming into North Dakota, and believe me, I'm not fighting that. You know where they're getting them from here? Amazon comes in for 1,400 employees. They're poaching them from CNAs from hospitals and nursing homes, parents from the schools. All of these people, quality service providers who are serving the facilities who serve those with intellectual and developmental disabilities, because Amazon can pay more, and we significantly changed it in the legislature, but Amazon can respond to market conditions, and they have like college bonuses and stuff like that. Well, the state isn't going to do that. So, and childcare, which for some of the people who might be willing to work but can't afford or can't find the childcare, I'm just trying to tell you that this is not easy from a lot of standpoints, and I'm sure you've all thought of this. But the connection between the tremendous workforce shortage we've got, and ours is one of the highest percentages in the country that we're short of, and the childcare challenge, which every place in the country has, and just the regular ones that are a part of providing the appropriate services for whomever we're trying to serve. It is a Gordian knot, and we're going to have a lot of challenges in trying to getting it all figured out. So glad you're all in on this so that we can work on it together.
Bruce, Judge Romanic.
One more question. If I heard you right, difficult clients is what I'm thinking of. Are providers just able to say, oh, I'm not serving this person, and then off they go? And then, do we do anything? Is there any, follow-up, or do we just, because we have a hard time getting them, we have to let them drive the show? Or is there something in place to say, well, you dumped 3 clients, we can't be giving you they can't cherry pick, I guess is what I'm thinking. But I'm sure you run into issues of that somewhat.
Yeah, great question. So we are actually changing our administrative code right now, or requesting that. It's going to go to the hearing in December, but we're going to put into place, which is what DD already has in place, to say that if you're providing 24-hour supports to someone, you need to give at least a 30-day notice so that we can try to find alternative services, and that person just isn't going to be without. And so that is something that we're adding, but we're also adding that if you have a pattern of absenteeism. So if you're a provider who says, oh, I'll help Nancy, and then you never show up, and that happens 3 times, then that's grounds for us to terminate our providers. And we do actually take those actions against providers who are not meeting our standards, because it's no good to have people on a list that are not going to follow through. So those are some of the steps that we're taking right now to try to get the authority through our administrative code to be able to do that.
Okay. Appreciate that discussion. Are there other questions?
Veronica has her hand up.
Okay.
Just a comment in response to Judge Romanic's question. P&A is getting a lot of contacts from individuals or their support networks about people being discharged from services, especially in the IDD area. So they're getting these 30-day discharges, and then when that does happen, it's often because there's a behavior or something. This person might be a person with high needs. And when that does happen, we're seeing that oftentimes another provider will not take them because of their own staffing issues. So I think there's a lot of concerns within the system when it comes to those discharges, and we are seeing some scary things happen with those individuals who are being discharged and not finding services elsewhere.
Yeah, thank you. Well, you can see, Nancy, that you've listed a lot of interesting comments and concerns, and you've given us an awful lot of good information and data to consider. Appreciate that. And you will be providing the slides to Jana?
Yes, we can share this. I'll get them to her.
It'd be great.
Thank you.
Is there anyone else that has any final questions before we close this part of the meeting? Okay, we really appreciate your presentation and the time that you put into it, and your willingness to come to the commission from time to time.
Thank you for the invite. Yeah, it's great to talk with you, and there definitely are challenges, and appreciate your interest and just your understanding of this topic, because I think it's got a lot of facets. So thank you for the opportunity.
Well, thank you. Okay. Now, typically, if we were at a meeting together, I'd probably take a break right now and let everybody walk around the table. But because we're on Zoom, just please take whatever relief time you need, but we'll continue on. And I would ask Jana now to go through the plan in the fashion the committee would like to do that.
Okay, yep, thank you. So for the last, well, it's been long before my time that this project started with the revision process, but the last 6 months, we've been working on the revision process. And so the subcommittee, I think everybody is here. It's Jake, Kayla, Scott, Julie, and Jennifer Henderson from Housing, and myself. I did email the commission members the draft that we're going to take a look at here. So I'll just share my screen in a moment. I have a few, and every subcommission members chime in when you need to, but basically I think our goal for today was to kind of look this over and see if anybody has comments or feedback. There is some data that's missing that will need to be included before it's finalized, but I will share my screen so we can take a look at that. Okay. Everybody able to see that? Oh, Veronica, you have your hand raised. Oh, no, it's not.
Yep, we can see it.
Okay, thanks. Okay, so because this is what 26 pages and we're scheduled for about an hour more, we're definitely not going through this page by page. Oh, Wally, we can see you now. That's wonderful. I wanted to start off by just opening it up. Does anybody have comments based on the draft that I sent last week? Veronica?
Just overall, great job, committee. This is very, very comprehensive, and it looks way nicer than I imagined. One thing I noticed, and this is just for a comment on anything or this specific section?
Anything in the plan.
Okay, under goals that had all the 11 goals listed out on page 5. We didn't have a goal on healthcare, and that is one item in the executive order. And it seemed like we got the other 5 of the 6 items. So I just wondered if that should be an element that's incorporated some way, if the governor thought it was important enough to put in there.
Good catch. Thank you.
And then the other comment is kind of in like the transitions to the community area. It seemed like there was a strong focus on like the settlement and target population members and skilled nursing facilities. And I guess I feel like we just heard Nancy's presentation, and I think that's one of the areas North Dakota is doing some of its best work. So I guess I would also just like to think about being more inclusive of other facilities, whether, that's like Representative Mitzcock said, Gero Sykes or, State Hospital. We've had a couple of clients that have been there well over a year. Could we be looking at those or looking at different metrics to measure that? LSTC, ICFs. I mean, I'm not saying we have to use one specific facility and single somebody out. I just think we should have like a wider scope of transitions we're examining.
Mhm.
I'll be quiet now. Thank you.
That's good feedback. Thank you. Senator Lee, your hand is up.
Yes, and thank you, Veronica. I have read it and I feel like he had told me how to build a watch, and what I wanted to know was what time it was. Because it is extraordinarily detailed and specific and sets goals in some of these areas that I think, where do we see a little success as we're working towards this? Because there is so much in there. In a perfect world, we would be able to do all those things. And with the challenges, which I mentioned a minute ago, I'm not saying we shouldn't try to meet them, but this is extraordinarily specific for what seems to me ought to be more like a vision statement, but I could be all wet and I'm waiting to hear you tell me why I shouldn't think that.
We actually, thank you, Senator Lee, because we actually, a month ago, we worked 3 months on this and we're like, this isn't way too much information as far as statistics and pulling from other places, strategic plans. So this is like the broad version right now that we sort of scrapped those benchmarks. And if I'm hearing you correctly, it could be a little bit more broad as a final plan.
I'm just thinking that there are, how many pages did you say this is? I read the whole thing.
26.
Well, that's ridiculous. Can we get it down to 4?
Well,
even 6? I mean, honestly,
I looked at other states and like Minnesota is like 116 pages.
Well, I can't think of any state I'm less interested in duplicating in Minnesota about darn near anything. But anyway, one of them talks about, I'm just going to change my screen here for a minute and forward to you something. I'm going to forward it to Jana and hopefully she will share it. There's one that calls for reports from all of the divisions in human services. Actually, what disturbs me a bit is that, qualified as everybody is who was on that group, you are all providers of services. That's wonderful. But there wasn't anybody from DHS. There wasn't anybody from DPI. I don't even think DOCR should be involved with this because we're not talking about incarcerated people. So I just asked for the spreadsheet for the Human Services Department because I just got it not that long ago. I've just got to find where a different Sally sent it here. Ah, there it is. Okay. And Jana Johnson. There you are. I am forwarding this to you and asking you that you share it with everybody that's on the commission, because you really can't ask all of, I mean, there's 100 different programs in the Department of Health and Human Services. And even looking at the 8 divisions that there are many that are not individually listed in here, and they're long without those being in there. The difference between the way human service zones operate in Cass County and Slope County, and its other 6 are very different. So, I think there, for those of us who are more knowledgeable about that stuff, and the most knowledgeable people are the ones who are in the system. I think that there needs to be more interaction. I don't see anything that really relates to, or any involvement from Kristen Basler's department either, and yet she's mentioned as providing reports. There has to be some engagement. I mean, you couldn't ask for a better person to talk about services to individuals with mental health issues and substance abuse issues than Pam Sagnes. And I never saw her name mentioned anywhere, as I can recall. Not that she should be specifically in here, but we need to have some, and we have the same thing with legislation. Sometimes people want to be too specific, and we find that you get like a year into a 2-year biennium, and you find out it's very constricting because what seemed really well-meaning and good at the time is not exactly going to fit what has to be done, and you can't violate it until you change it in the next session, or some idiot brings up an initiated measure. And I chose that word intentionally. Anyway, that's my concern, is that I don't see that there's any input or balance from the departments whom you're asking to report to you and to provide the services. It's just for the providers, and it should be all of you, or all of
Right.
us, whatever.
And we did bring that up, and other subcommittee members chime into of they're the experts in their field, so they should have some buy-in in this and sort of steer what this plan says about their
Absolutely.
specific. Yeah.
Anyway, you should have in your email box by now the organizational chart for the department, because it is complex, as I know you know, but this is the new organizational chart for the department when it's merged with Human Services and Healthcare, and who the various executive directors and officers are for each of those departments. But there are many other programs and individuals under some of those folks. Pam Sagnus's responsibilities, only 3 things are listed in there, and yet she's going to be part of the major part of the planning of the new state hospital. She is responsible for all 8 of the state's regional human service centers now. She is absolutely in charge of all of the mental health and behavioral health programs through being the division director. And you could spend a long day talking about all the stuff that she does, and she is so smart that it wouldn't be a bad idea to hear what she has to say, because we might be able to take a little bit of a different direction in some places. We shouldn't be telling people what to do. We should say, we recognize that these are the services that people need, and enable the people, the providers and the departments, because they're enabling providers by funding them or providing them themselves, to be able to figure out what the ways are to do it and not be too constricting in the way it's done. And I just think this is too prescriptive. And that's just me. I don't get paid well for this meeting, so I'll shut up now.
So Veronica had put in the chat that she agrees we need participation from state agencies named in the executive order in all of our work. And that is something that the co-chairs and I have talked about. Is there are several departments that are not included or invited to this meeting that we are working on getting contacts for, so at least they are in on the commission as a whole. And specifically, we did talk about that related to the plan too within the subcommittee.
Well, I do hope that you will send this out to them so they have a chance to review it and have a little input on it, because they're not going to say throw the whole thing away, and neither am I.
Yeah.
But I think having that input from them to say, because somebody out there is, and I'm thinking of Pam because I work with her a lot, is going to say, but these are the conditions that we have these are the number of people that are doing what, and how do we accommodate the flexibility that's needed in order to do it? Because we've got a whole lot of people, just as the providers on this commission are, working really hard to try to do the right thing. And part of the big problem, of course, is we don't have enough bodies to do the work. So what can we do to make sure that we're at least able to provide appropriate services in the best way we can with the resources, and I don't just mean money, available? There was enough turn back in the last human services budget to hire a whole bunch of workers, and they didn't use it because there was nobody to take the jobs. So it isn't that money hasn't been appropriated. There just aren't any people applying for those jobs. So, I don't want you to think that the department or the legislature is bailing on this because the money was there, but the people are not.
Veronica?
Just listening to Senators Lee's comments, I think she has a good point in that this plan is very, very comprehensive. So maybe the thing to do is, whatever the final plan looks like, if it's this detailed, I think this would be something very helpful for you as a staff member, maybe when you're kind of doing your day-to-day work. But maybe we could also develop like a more simplified document for like the public and members that is like more of a high level overview, so people don't have to get into the weeds if they're just kind of trying to get the gist of things.
Yeah, that is something I saw too with other states, that they had like a plain language version that was much shorter than the actual plan.
So then
yeah.
even just make some of this supportive documents, you know, this is sort of the footnote stuff in some ways. Because if I were a provider, I would want to see what some of these goals would be, as well as individuals who might be served. But let me compare it to the Constitution and state laws. The Constitution is a skeleton, and the state laws are the muscles, because we shouldn't be doing much changing to the skeleton. But the muscles are going to change depending on how we work them. And the same way with the state laws, we can change them as is appropriate with the needs that are there, the resources that are there. We don't want to put everything in the Constitution, because then it takes 36,000 signatures to put it back on the ballot and hope people change it in a way that's going to work for the people of North Dakota. So let's try to make this more of the skeleton / Constitution. And much of this can be the supporting documents, which would then be the muscles and the state law, in my analogies here, my metaphors.
Sure.
Yeah, and this is exactly why we're bringing this to the commission, so that the commission can respond to it. There's no plan to make a motion to accept it today, but it's a work in progress and it's evolving. So all of these comments are helpful, and it would be nice to hear from the committee, what it was like to work on this and how you feel we should be going. You who've lived with this.
So since we are just looking at the goals page right now, I wanted to jump in, and I added an assistive technology goal, and I wanted feedback on that. We talked about that today with Nancy's presentation. North Dakota's trying to do more as far as using technology both as a supplement to direct service workers, but also as a means of diversion to keep people out of higher levels of care. So I just wanted to bring that to the commission to see if we are in favor of actually having something like that in the plan.
This is
This is
Carlotta.
Julie.
I'm sorry. This is Carlotta. I think that assistive technology is a really wonderful thing and a wonderful tool that can really add to somebody's independence in their community, in their home.
Thank you.
This is Julie. I like that too. And I saw Senator Lee's comment too or maybe it's a way to support the gold process or something like that.
Okay.
I like the AT goal as well. If we feel like we're getting too many goals, perhaps that could be wrapped into community services and support or workforce development, depending where we thought it would be most appropriate.
Sure. And some of these, I did the like the parentheses, sort of naming where the goal came from as far as the executive order. So obviously not all of these are named in the executive order, and healthcare was left out, not intentionally. So that was something else, is perhaps this next draft, we combine some of these or target one specific to the executive order and then put like workforce shortage or community engagement under those broader goals. So with that in mind, with Senator Lee's comments and suggestions, as a subcommittee or commission as a whole, do we want to spend time on going through this and trying to identify some of the information that I was looking for? Or should we reconvene as a subcommittee and kind of make this a little more bare bones?
Jenna, this is Jake Reuter. I think it would probably be helpful if we go ahead and meet again and try to, address the comments and suggestions and develop the Constitution version versus the laws and law and order kinds of things. So I think it would be worthwhile to do that.
Sure. Senator Lee?
And I agree what Jacob just said. I also was going to suggest that if you reconvene, that you might allow a little time for a rep from DHS and a rep from DPI come after having had a chance to read this. You know, just to provide a little input, and you don't have to do what they say, but I think their background information might be helpful to you as far as the logistics of how some of this would work, especially if some of this is going to become the supporting information, you know, the muscles and not the bones. Talk to those guys first and then come back to the whole commission again.
So with that in mind, this was written, this draft, prior to me coming, and it was written to be a working document or sort of a living plan based on comments from Senator Lee. Is that how we want to keep this, or do we want more of a constitution where we are not revising every 3 to 5 years? We are maybe receiving reports from these agencies where we can monitor how they're doing towards progress overall. Thoughts on that?
Jenna, this is Jake again. One of the things that went into the whole idea of reconstituting how the Olmstead Commission works is to really go from just an entity that accepts reports from DHS without really any action and teeth to try to push the system forward. So I think a combination. I think the idea of an overarching, here's what our role is, along with that attachment around what goals we need to work on based on the identified concerns that this committee gets, either identifies internally or is identified by other members, whether they're from the department or from people getting services or advocacy organizations, because the hope is that this committee could drive the change. So that's just my 2 cents from being a part of that original work.
Thank you.
Yeah. I certainly appreciate Senator Lee's concern. She is an acknowledged expert in working with human services and the other departments. But I agree with Jake there that there are times when no matter what their resources are, we have to tell them they have to do more. I mean, it's good to be sensitive and respond to the resources that they don't have, but we may have to underline things that are necessary. So, or at least in our position, carrying out the order. And while we're together, I do see taking this back to the drawing board. But if there's more comments on other people's reactions to it, one of the things we talk about with Jana is to be in tune with other Olmstead Commission around the country, and I appreciate the fact that working with our neighbor Minnesota, you've been able to cull their 100 and some pages down to 26 or 28. So I don't know. To me, a 4 or 5 or 6 page report may not be enough either. So I think there's a medium that we have to find in the work of the committee at this point.
Yeah. Julie?
I think it would help the subcommittee members as we look at this again, kind of a little more direction of what we would like that to look like. Are we thinking sort of maybe a 1-pager standalone of what we are and the goals we identify, and then supporting documents of kind of objectives within these goal areas, and try to condense a little farther with maybe less? Is that like the thought you guys are having, just so we can provide something back to you that's that's worthwhile. Is that kind of the thought? Kind of have some separation of the documents, and this is what we'll do within, but not too prescriptive, but have things stand alone a little bit, so it's just easier.
I guess I would look to the subcommittee to, through comparison and other requirements of the DOJ, to make sure that we're in compliance and that we have a document that works. A one pager seems pretty thin to me in terms of all that's here.
Yeah, I don't know that I would, well, I'm not just saying it's just me, but I don't expect to be able to get that done for sure. Senator Lee, your hand is up.
Only because I didn't say one page.
Oh,
If you shoot for 4 to 6, if you shoot for 4 and you end up with 8, we can talk about it. But 26 just, I think if somebody has a particular question who's looking at what's going on in their lives, never mind the DOJ only in my example here, but Joe Schmatz, who's living someplace where services are not what he would like to have, or she, but they're mostly concerned about one facet of it. Let's give them that paragraph or that small amount of coverage, and then have a sub note that says in supporting information number 3, there are more details. See where I'm going with that whole thing? Because somebody might not need to read the whole thing in order to get the picture. They might want to. They could read the whole thing with all the supporting documents, but just make it a 2-parter. Something that has far fewer pages than 26 to start with, but that will have the supporting information appropriately. I mean, you've all done a wonderful job on this. I don't want you to think I'm unhappy. You had to have spent a ton of time on it. But I think we are providing how to build a watch when sometimes people do want to know what time it is, as I said before. Let's figure out a way to let someone peruse it and say, oh, this is really good. I'm going to dig a little deeper and read that supporting information.
Yeah. Veronica.
I can see that being a good idea. So for instance, you know, you have like the workforce development goal, and under there you have 3 different activities. Maybe instead of including like the baseline and all of the heavy data, you can just like link to the resource, and we can have this as a background document for us that lists out how we're deciding if we're doing a good job with these goals, but just leave like the goals and like the more high level overview there for us to see.
Yeah, that's kind of what I'm picturing in my head of the next revision of what we want to see overall as a goal, and then having, like Senator Lee said, that supporting documentation if you want to read on further of strategies or ways to go about that.
Senator Lee, your hand is up.
Sorry.
Oh, that's fine. Is there anything else the subcommittee would like to see the commission address before you go back to the drawing board?
Well, looks like Judge Romana, you've got your hand up.
Yeah, I think you did really good work. I understand what Senator Lee's trying to say. I'm just going to put out, ever since we started this, we've kind of struggled. What do we do? How do we do it? So I'm wondering, is this for us and not for anybody on the outside coming in and reading it? But we can go and say, look, this is one of our goals. This is our strategy. This is how we're going to move forward. I mean, that's how I read this, is maybe that's why it was put together and how it was put together. You know, like I said, we've kind of struggled. You know, the governor told us this is how we're going to do things. And then, you know, we've come here and said, how do we enforce this? How do we look at this? And I think this kind of is a good starting point. You know, the fact that it's 26 pages, I get that. But if someone on the outside wants something, they're going to go to vision statement or goal 1 and look at goal 1, or we can direct them there. You know, so, I mean, if we want to have something smaller that then points to this document or something similar, I think it's a good idea. But it does give us a roadmap, you know, and I don't know, Senator Lee, we're gonna talk a constitution. Well, that means we gotta file statutes every 2 years to change it and and then some judge is gonna have to review those statutes. So I think this is a good start.
No, we don't, you
Change.
can't file statutes every 2 years to change the Constitution. You gotta go back and get 36,000 signatures on a petition. That's
Oh, no,
what's
I
wrong
didn't
with
mean that. I mean, you're talking the bones and muscle, you're filing statutes to expand or, use the Constitution. And if that's how we're treating it, then, I get that. If we want something smaller on the front end, for the general population to look at, maybe that's where we get something. But we need something like this, I think, for the commission's direction more than anything, because like I said, at least from my perspective, I think we've struggled with that ever since, I came on board or when we reinstituted the commission. That's my 5 cents worth.
Yeah, and if I can piggyback off of that a little bit as a newcomer, as I'm working on this, I'm thinking that this is a way that we can have some oversight if we're hearing about things in the community or barriers or people, anything Olmstead related, and we have a plan of saying, okay, this is our goal in that area. What can we do? They're not making progress. It's not so much enforcement, but oversight is how I was looking at it. It gives us a place to start if we need to make systems change at some point.
I'd go back to our strategic planning, I think that we did a year ago, and that was maybe a 3 or 4 page document by the time we were done with it. I mean, I think we had 7 goals there. This has a way of flushing all that out and putting it down as a work plan in a very good way. We could go back to the presentation to the public being something that looks like what we did when we were strategic planning, which contains these on a high level basis. But I think, we will be deciding when we're going to meet, but this might be a good place to come back in February at our first quarter meeting to see where this goes. I mean, by condensing it. I think that's, you're right. A 26-page plan does take a certain amount of time to review. And that kind of puts you at odds with the public too, because most people don't want to read a 26-page document. Most people don't read their insurance policies, Senator Lee.
My hand isn't up. It isn't supposed to be anyway. Oh, dang, I put it down and now it's there. Sorry.
It's okay.
And as far as my vision for formatting is, I would love to make it like the index where you can click on it, it takes you right to the link that you're looking for instead of having to scroll through however many pages it is to find maybe the particular topic you have questions about. So.
Well, for asking the subcommittee to continue their work, any other directions you'd like to hear from the commission? Any other inputs? You who've worked very closely on this document?
I will invite the commission members to send me any suggestions or feedback you may think of after this, because we're certainly not, it's going to take some time to create.
And Senator Lee, if you wouldn't mind, you mentioned a couple key individuals, Pam Sagnas and others, who you think we should be talking to and maybe working with. Do you have other individuals that you can maybe give Jana as they go back to the drawing board on this?
Well, I think Nancy Nicholas Meyer is just extraordinarily good at what she does, and we are already communicating with her, but she hasn't had a chance to read this. And it's not because I think they ought to tell you what to do, but to me, this is kind of like a hearing. I spent a lot of time hearing what people have to say and hearing and sorting it out. And, you pick some stuff up and you leave the rest on the table. But I think just a little review by the head of the Division for Behavioral Health and by the Superintendent of Public Instruction would not be a bad thing to have coming in. I know that DOCR is mentioned there somewhere, but I continue to say that DOCR is involved with people while they are incarcerated, and the Department of Human Services, and in the case of certain age groups, DPI are involved with them once they are out. So this should have more relationship to those two departments than to DOCR, but I'm not opposed to your talking to them. I just don't think they have much that relates to this.
Sure.
Is there anyone else that's would like to comment before we close this part of the meeting?
Thank you for the feedback and comments. I appreciate it.
Yeah. Well, thank you. I think what you're also hearing is everybody believes that you've done it. Bringing all this together. So we appreciate the work and look forward to visiting one more time. Hopefully in February we can come up with something that we can endorse going forward. So the next item on our business is just coming up with the meeting dates for the 2024, and the suggested dates: Valentine's Day, February 14th, May 8th, August 14th, and November 13th. Anyone have any conflicts that are apparent and obvious at this point?
This is Scott. I don't have any at this point, but who knows what will happen.
Yeah. Well, with this amount of people, there will be, there just naturally will be conflicts, but anything right now that we have a lot of flexibility as we look at these.
Perhaps Janet could send out, or someone could send out a save the date that would plug it into all of our Outlook calendars, and that might be a good way to find out how things are going as we move along.
Absolutely.
Would that work?
For sure.
I think, from a administrative standpoint, we'd like to at least adopt these with the idea that we're flexible if something comes up. And I guess I would entertain a motion to approve the suggested dates for 2024.
This is Scott. I'll make that motion.
Thanks, Scott.
I'll second.
Thank you, Veronica. And like I say, knowing that this will exercise some flexibility as we put these into play. All those in favor signify by saying aye.
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 Opposed, same sign. Okay. All right. Well,
Molly,
next.
the only thing on there, sorry, is the hybrid or online options. I know we've had some discussion around that with technology issues in the job service building, like we don't have to have it there, but if we want to have a discussion of preferred platform, or leave that up to co-chairs to make the final decision.
Because of the size of our state and the responsibilities that our members have, I guess I'm liking the idea that we do a hybrid where it's nice when people can attend, but it's also convenient if they can attend by Teams meeting or whatever. Anybody else have any thought about hybrid or online?
I like the hybrid option. I'm attending today from Chicago, so it's nice.
It is nice, yeah.
I agree.
I think it also increases accessibility for people who might not have internet or a computer or know how to access a meeting online.
And when we're meeting in months like February, we also have to think about weather. It makes a difference too, how far people can travel.
this is Ramonic. The meeting's gone really well today, I think. Sometimes when we're got some in and some out, though, it seems difficult, you know, the hybrid. It's good to have in person too, but I just know, you know, when we're all remote, everybody can hear, everybody can participate. A lot of times it seems like when we're, you know, some are in and some are out, we've had some difficulties, but maybe we can overcome that.
Yeah, I'm on a number of boards, and I'm finding most of those boards are now going to the hybrid option. It just seems it cuts out travel, it cuts out wasted time. It keeps meetings, you know, for something on being in Zoom or in Teams, 2 hours is a pretty long meeting. Where when you're together, 2 hours doesn't seem that long.
Well, I'm on my way to Bismarck in 15 minutes. And so I'm glad that I was able to do it virtually because I could do that at home and then leave. And so I do appreciate that because I didn't really want to go this morning. That didn't work out for me either. So thank you for allowing it to be virtually accessible, whether we have in person or not.
Yeah, thank you.
Well, I think maybe going forward, we can just make a decision as needed. I think that venue location or venue change may be needed just because of the technology issues that we've had, but I agree with Judge Ramonic. I prefer one way or the other because when you get hybrid, then you just get that overlap of in-person problems and technology problems, so.
I proved that today too, and I have no idea how I all of a sudden appeared after disappearing, so.
And with a fancy background even.
Yeah, yeah. This is artificial. This is not the penthouse that I live in. We
I was
have.
hoping it was and you'd invite us all over.
Yeah, I wish this was my spot, but the fourth item on our agenda is the advisory council comment, and you know, maybe you want to lead into that, Jenna, as to the fact that you've had a meeting and we are now actively promoting the advisory council.
Yeah, so we did have a meeting in July, and we haven't had a meeting since. The majority of my time and with the subcommittee has been working on this Olmstead plan revision, so there wasn't anything to present yet to get feedback on. So now that we've sort of have that draft finalized, we will reconvene again after this. I will put out some meeting dates to the advisory council to meet here in either end of November, early December.
Okay. Now, I know that there's a number of the advisory council that have attended today's meeting, and so I certainly would open this time up for any comment by those members as well. And then after that, we'll have just general public comment for anybody else who's not part of the advisory council. I see Matt Swartz. If you want to go ahead and speak, Matt, please do.
Yes. I just want to say that I appreciate all the work that's gone into this by the subcommittee. As some of you may recall, the question was asked of me to comment a long time ago prior to the council, and I think I mentioned something about the commission being in business for about 20 years. And I also appreciate Senator Lee's comment, trying to keep things simple enough. But in view of that, I'm one of those that is at home trying to figure out how I'm going to make all this work. And I am familiar with a century code 25-01.2-02 that apparently was placed there, and I don't know all the details, what the intent was. But I bring that to your attention. I understand that was a result of the ARC lawsuit. And it's very simple. It says all individuals with developmental disabilities have a right to appropriate treatment. Quote, a right to appropriate treatment, services, and habilitation for those disabilities. Treatment, services, and habilitation for individuals with a developmental disability must be provided in the least restrictive appropriate setting. I'm just wondering if that's something that you all have some thoughts on, and I don't know, whether we have enough time to address it, but my understanding is that if this class of people has the right, what does that imply? Thank you.
Thank you, Matt. I guess I would open it up to the commission. Anybody who wants to dialogue on that, we'd be glad for your comments. I know that that's been something we've all lived with for a number of decades now. I was even the Assistant Attorney General at Grafton 10 years while we deinstitutionalized folks at that point. So I mean, that's the ARC suit is part of our history. And ultimately, that lawsuit and the Olmstead lawsuit, are kind of leading us as to where we are today too, with the fact that we're even meeting as a commission today. So. Most of us don't have access right off the top to that century code, but I think we know the basis of that too, Matt. So. Anything else, Matt, that you'd like to underscore there?
I just wanted to address it in view of all the work that's been done by the committee or the subcommittee, and that the issues I'm feeling address that very simply. And I know it's a difficult job to do all the work that is being done, but it seems to me that this was pretty clearly addressed back at that time, and the challenge is, how do we become creative and make this work? It's been in Century Code apparently for a long time, and I don't know what all that implication is, but as I understand, it was developed at that time and put into Century Code for a reason. What it all means might be something for some discussion in view of trying to develop, more documents and plans, which I know need to be done. So just wanted to raise that.
Yeah, thank you for doing that.
Yep.
It is the kind of thing that if we did some background, some research, and a way of quantifying what, that for the individual that's involved, and I certainly know your family and you and your daughter have just a lot of work and a lot of care and a lot of all of that goes into it, and just how can the state better help a situation like yours? That's something that we're certainly cognizant of.
Cheryl has her hand up. Did you have a comment, Cheryl?
Yeah, I guess I can't see all the hands. Cheryl Beard?
Yep, and I think if you're trying to talk, Cheryl, you're on mute, so.
We still can't hear you, Cheryl. If you're hitting the microphone button, that would be helpful. You should be on now. It looks like you're clear. Can you hear us, Cheryl? We're not hearing you. I'm not sure, Jana, just how we can help the technology here.
I can't unmute her, unfortunately. And even when she was unmuted, I'm wondering if it's something to do with your settings, Cheryl, because when you were unmuted, we still couldn't hear you.
We're sorry about that. Technology is wonderful till it's not. Are there any other comments? If you keep working on that, Cheryl, but up to now we just are not getting any volume from you. Okay. I think what I'll do now is shift from the advisory council, who we appreciate being here, to anyone from the general public that has been part of this conversation today or been part of this meeting. And once again, we'll look to see if your hand is raised. Try to respond to you. Okay, well. Looks like a number of folks have left that because they're no longer on chat either, so. Was there anything else for the good of the order? We've 2 hours have gone by pretty
Julie
quickly.
might be talking to Cheryl right now to get her comment.
Yeah, I am. Is that okay? Cheryl just wanted to say she thinks the commission's on the right track.
We appreciate that.
A little more, sorry. Go ahead, Cheryl.
Yes, you can see we're waiting
Yeah,
for.
she would like us, sorry, to focus on keeping it short to understand it all.
Oh, in terms of the plan.
Yeah, in terms of the plan, yeah, but she likes the goals and how it's looking, but just to understand it all, to keep it shorter for people.
Okay. Well, thank you, Cheryl. I appreciate those
Thanks,
comments.
Cheryl.
Thanks very much. Well, I thank all of you for your attention today and your participation, and appreciate the work that we're seeing the subcommittee accomplish and the valuable input that the commission has had. So I just say, if there's anything else for the good of the order, please let me know right now. Otherwise, we will end the meeting and finish today. Thank you for your attendance, and we'll look forward to visiting with you again in February. Thank you all.
Thank you.
Thank you.
Thanks, Wally.
Yeah. Yeah, he did. He really did. Yeah, he did.